The HSRC conducted a survey on how South Africans are responding to the lockdown and to the coronavirus. In some instances, the research found that South Africans had no interaction whatsoever with the law enforcement officers during the lockdown. The Minister of Higher Education Blade Nzimande says it's worrying that some South Africans feel they are not at risk of contracting the deadly virus.
It is indeed of concern that the study points to the fact that 1 in 2 people believe that they are low risk, because it tells us that we've got a lot more work to do on an ongoing basis. But it's good that research is telling that, so that we know as government that we have to intensify education. And for people to understand the point that Deputy Minister Pasha was making, that everyone is almost equally at risk. No one is more at risk.
And to tell us more about this survey, I'm joined via Skype by Professor Sibusiso Sifunda from the Human Sciences Research Council. Professor, a very good evening to you. Thanks for joining us. Welcome.
Thank you very much. Good evening to you.
With about 87 deaths already and about 4,000 infection rates in South Africa, why do you think South Africans still do not take this virus seriously?
I think it's really about, the amount of information that people have, and, and if this thing is happening elsewhere, you're not going to take it seriously unless it gets closer to where you are, or you get to know someone who's actually infected with the virus. So it's not surprising until people start to see families and members and neighbors getting this virus. That's only then will they take it seriously. And
is there anything that the government can do to change the mindsets and to change the behavioral attitudes of people to ensure that they understand the seriousness of this disease?
Well, I think the government has done very well. I think everyone now, our research actually traces what was happening probably 3 weeks ago. And I think through the lockdown and some of the things that the government have implemented, people are starting to actually realize that this is actually not a joke. And actually also, if you look at the numbers, rising almost on a daily basis, I think the perceptions are going to change, and even how people rate their risk is going to change based on what's happening currently.
Just judging from the rates of arrests the data that has been shared by the police minister, it does indicate that it's still a long way to go before people start understanding the importance and the seriousness of COVID-19 and the fact that, they are continuously spreading this disease with regards to their stubbornness.
Well, I think, one of the things, risk is also based on how severe people think that the disease is. And I think in South Africa, one of the issues was initially there were not a lot of deaths that were happening as a result of this. And we're actually now seeing an increase in deaths. And I think that's when people are actually seeing that this thing is more seriously than we thought it was. Because before we're seeing a number of cases increasing over time, but we're saying no one is dying so far. And then people were not going to really think this thing is as serious as it's made to be.
Professor, I want to pick your brain on the issue of the cigarettes. The ban was lifted just recently by the president when he said that when the country progresses from level 5 to level 4, that is when the ban on the sale of cigarettes will be lifted. Do you think that the government is dropping the ball on this one? Because cigarette smoking, there's this phenomenon called scafe or puff and pass, wherein people share the cigarettes, and that is one means of spreading the virus.
Well, I think most of the decisions that are being made about this are not, kind of reached upon very easily. I think a lot of things get considered. But I think the real issue is to educate people that, you cannot pass a scathe in the time of coronavirus. You actually need to buy your own cigarette, or even if it's a single or a loose, you must buy your own. And you cannot pass it around because those days are gone. We cannot do those kind of things. So in my view, I think there's always needs to be a balance. So I would, I wouldn't say cigarettes are essential or not, but I think those who smoke really need to change the behavior, because coronavirus is really about how people behave, regardless of what they're doing, whether it's social distancing or hugging and shaking hands and high fives and all those things. So even smokers, even when they get allowed to buy cigarettes, they're going to have to behave differently on how they smoke, between themselves as friends or whatever.
Yeah, sure. And the mentality is that if the cigarette sale, the ban rather on cigarette sale was lifted, then the same protocol should also apply with regards to alcohol, because alcohol is still, it is the same medium for the transmission of this virus. It does suggest that the Human Science Research Council is also condoning such behavior, because one of the recommendations by the council is that tobacco, I'm going to quote you verbatim, that tobacco control interventions must be put into place to prevent the illicit trade and smuggling, and the results also call for better regulation of tobacco sales in informal markets. The most important thing is to identify that vehicle or that catalyst that seeks to spread the virus, and then just pull the plug on that one.
Well, I wouldn't say we're condoning the sale of cigarettes or any substance for that matter. What we actually found out is that it was easier to get cigarettes than alcohol during the last 4 weeks of the lockdown in the country. And in a way, you could see that alcohol was easier to control in terms of access to alcohol, apart from, a few incidences of people breaking into liquor shops and stuff. But so people who smoke were going through every trick under the sun to actually get cigarettes. So we're not really, in a way, as the HSRC, condoning cigarettes. In fact, we as public health specialists, we are against cigarettes, I could say. But you have to balance in terms of what's the safe way to allow people to access certain things, and what should be the education and messages that we put out there to make sure that even if cigarettes are allowed to be sold, they do not contribute to the further spread of the virus, because that's the whole point. I don't think banning substances is to control the population. Banning substances, as you say, is to manage what we are faced with right now.
Sure. And no, by all means, a social compact needs to be created with the communities and the public and the private sector with regards to ensuring sustainable financial and social relief. Just the past week, the president has also announced a stimulus package that would help those severely affected by COVID-19. I suppose then we need to analyze the efficacy of the lockdown regulations in a country where there's a huge chunk, where the huge chunk of the population still lives on a hand-to-mouth basis, who cannot afford to stay at home, and all they do is just go out and hustle for food. Do you think that this kind of mentality, this kind of social living will help curb the spread of the coronavirus?
No, I think as the HSRC, we've always been of the strong point that this is actually right now a disease that can only be contained through social behavioral interventions. There is currently no biomedical intervention that can actually help us deal with coronavirus right now. There is no vaccine, there is no treatment, and we really need to focus on how we're going to actually make sure that people understand that this disease, as things are now, can only be controlled and be contained through the population of this country, and everybody kind of understanding that we need to agree and embrace some of these interventions and all of them, in fact, that are being brought there, because that's why we are all sitting at home now. If there was a vaccine, we will not be sitting at home. We would be all over the place. So human behavior is currently probably the best vaccines that we have right now to deal with corona. And basically, as part of that is also to make sure that people don't suffer. And if you look at our survey, it actually deals with a whole lot of things in terms of access to food. We deal with access to medications. We also look at, relationships within households as they sit at home during the lockdown. So we really, this requires a human intervention. It requires a social compact for us to actually be able to conquer it as things are right now.
So how should a model be created between the healthcare system and the local community at municipal level?
I think, we really to actually give all the credit to our healthcare workers, who are out there in the front line. The HSRC is actually also conducting a survey that's specifically focusing on healthcare workers, on their needs and their experiences and what they are doing right now to deal with the clinical part of this of the coronavirus. But I think communities, by and large, including municipalities, government at all the different levels, still really needs to come together and understand and actually reach out to each other to actually ensure that we actually control this virus before it even becomes a problem that our healthcare workers in hospitals and elsewhere need to deal with. And that's really where the war is right now. We must actually fight it at community level to ensure that we prevent a situation where it needs to now end up in hospitals and where people need actual healthcare and treatment, etc.
Professor Sibusiso Sifunda from the Human Sciences Research Council, thank you so much for your time. We appreciate it.
Thank you very much.